Everyone, thank you for joining us. Today, we'll take a closer look at substance use and substance use disorders, often abbreviated as SUDs, within the veteran population in the United States. Veterans are a unique and diverse group with distinct life experiences that can affect their physical, emotional, and behavioral health. Many have endured prolonged stress, trauma, or injury during their service, factors that can significantly impact substance use. Let's start with a few foundational statistics that highlight just how widespread substance use issues are for veterans in the United States. Among veterans who receive care through the VA system, up to 52.5% have had a substance use disorder at some point in their lives. That's a significant portion of the population. If we remove tobacco from the equation, which is often tracked separately, the number still stands at 39%. Looking at more recent interactions, roughly 1 in 9 veterans, about 11%, who visit a VA medical center for the first time are diagnosed with the current substance use disorder. That means that substance use is not only a past issue for many veterans, but also a pressing present concern. However, it's important to recognize the limits of this data. These numbers are derived from veterans who are actively engaged in VA health services. As of 2023, only about 42% of all U.S. veterans are enrolled or accessing care through the VA. That leaves a substantial portion of veterans whose substance use status is less well documented and possibly under-addressed. Many of these individuals may face barriers to accessing care or may seek support through non-VA providers or not at all. Let's take a closer look at the substances most commonly used by veterans. Alcohol remains the most prevalent concern. Approximately 10% of VA outpatients meet clinical criteria for an alcohol use disorder, meaning their drinking is more than just social. It's affecting their health, relationships, and daily functioning. Even more striking, over 24% of veterans report binge drinking in the past month. Tobacco is another critical concern, both for its addictive properties and for the health consequences associated with long-term use. While about 29% of all veterans currently use tobacco, among those in treatment for substance use, the rate jumps dramatically. Up to 79% report regular tobacco use. This suggests a strong link between tobacco and co-occurring substance use disorders, particularly as tobacco may be used to cope with stress, withdrawal symptoms, or emotional distress. Cannabis use is also on the rise. Surveys indicate that around 12% of veterans used cannabis in the last year. While some may be using it for medical reasons or as an alternative to other drugs, 3 to 6% meet diagnostic criteria for a cannabis use disorder. That means their use is impairing their functioning, becoming compulsive, or interfering with other aspects of life. As laws change and social norms shift, cannabis use is likely to continue increasing, making it a substance to watch closely in this population. Now let's shift our focus to illicit drugs and the misuse of prescription medications. Illicit drug use among veterans is not as common as alcohol or tobacco use, but it's still a significant concern. About 5.5% of veterans report using illicit drugs, such as cocaine, heroin, or methamphetamines, within the past year. These substances carry high risk for dependence, overdose, and legal consequences. One area of growing attention is prescription drug misuse, particularly involving opioids. Among post-9/11 veterans, the misuse rate for prescription opioids is about 4.7%, which is nearly double the 2.6% seen among pre-9/11 veterans. This suggests that younger veterans, or those who served more recently, may be at a higher risk, possibly due to combat-related injuries, chronic pain, or challenges integrating into civilian life. It's worth noting, illicit drug use is often underreported. The data we have is likely conservative, as stigma and fear of repercussions can make veterans hesitant to disclose their use, even in anonymous surveys. This makes it all the more important to foster safe, non-judgmental environments for screening and treatment. So who is most at risk? Research shows that substance use disorders affect certain groups of veterans more heavily than others. Young veterans, particularly those aged 18 to 25, show the highest rates of substance use overall. This age group is more likely to engage in risky behaviors and may have less experience managing stress without substances. Men are statistically more likely to report substance use than women, though female veterans face unique stressors and may be more likely to use substances in secret, making their struggles less visible. Unmarried or unemployed veterans and those experiencing homelessness also face a much higher likelihood of developing a substance use disorder. For example, housing instability and job loss can increase feelings of hopelessness, isolation, or desperation, all of which can drive substance use. Mental health is another key factor. Veterans living with PTSD, depression, or anxiety are significantly more likely to also experience a substance use disorder. Let's take a moment to look at how substance use has changed over time within the VA system. Between 2010 and 2019, the number of diagnosed substance use disorders increased each year, rising anywhere from 2 to 3% annually, depending on the substance. Those aren't minor fluctuations. They represent a growing wave of need for care, treatment, and resources. Since 2016, cannabis and stimulant use disorders have shown the steepest increases. What's especially noteworthy is that these trends are becoming more common among older veterans, not just younger populations. That challenges some of the assumptions we may have about who is affected by substance use. Oh, sorry about that. We're going to move on to the next person. With that foundation in place, I'll now hand things over to Kristen, who will guide us through the next step in our journey, learning how to engage veterans with clinical skill, cultural competence, and an understanding of the unique challenges they face.
This slide is knowledge needed to engage, assess, and treat veterans for substance use problems. It is so small. Understanding unique stresses. When treating veterans with substance use problems, it is essential to understand the unique stresses that veterans face, including combat exposure, frequent relocation, as well as reintegration challenges, which to a great extent helps in building trust and rapport with veterans. Connection between trauma and substance abuse disorders. Many veterans have experienced significant trauma, such as, but not limited to, combat as well as military sexual trauma, which to a great extent associated with mental health disorders such as post-traumatic stress disorder, severe anxiety, as well as depression. I can't even see. General understanding this connection is important due to the fact that it allows providers to address the root causes of addiction and deliver more effective trauma informed care. Co occurring mental disorders. Veterans often experience complex clinical challenges, including but not limited to co occurring mental health and substance use disorders, depression, anxiety, PTSD, as well as traumatic brain injury, among others. Therefore, providers to a great extent must understand how these interact with substance use consequently, developing or rather tailoring integrated treatment approaches. Evidence-based treatment models. Moreover, familiarity with different evidence-based treatment models, such as motivational interviewing and trauma-informed cognitive behavior therapy, seeking safety as well as medicated-assisted treatments for substance use and mental health disorder. Uh, Practitioners also required knowledge in relapse prevention, planning, crisis intervention, building therapeutic alliances, group facilitations, as well as evidence based treatment delivery. Generally, this knowledge is essential because it enables providers to deliver high personalized, effective care, which to a great extent addresses the unique and complex needs of veterans. The attitude needed to engage, assess, and treat veterans for substance use problems. Empathy and non judgment. Given the shame and stigma often associated with deep seated trauma and mental health and substance use struggles, providers need to convey acceptance as well as understanding in order to allow veterans to feel safe disclosing sensitive information. Cult- Culturally, humility and respect. Maintaining cultural humility as well as demonstrating respect for veterans' experience to a great extent helps reduce stigma while also fostering a safe therapeutic environment. Concerning this, it is essential for care providers to recognize and respect military culture and be open to learning from veterans' experiences while also avoiding assumptions such as regarding their service and also, struggle consequently. Fostering strong therapeutic alliances. Committed to strength-based care. It is important for care providers to perceive veterans as resilient individuals with not only valuable experience, but also skills as opposed to solely focusing on their problems as well as deficits. This is essential due to the fact that it is supports recovery and also empowerment. Furthermore, it also is essential to convey a strong commitment to not only partnership with also empowerment as opposed to a purely directive approach, which to a great extent aligns with trauma informed care principles. Patience and flexibility. Generally, it is essential for care providers to not only adopt their approaches, but also give veterans the time they require in order to not only build trust, but also progress. Commitment of trust building. Care providers should prioritize honestly as well as reliability, which can help in developing a strong therapeutic alliance. The skills needed to engage, assess, and treat veterans for substance use problems. Comprehensive assessment skills. Generally, in order to effectively help veterans with SUDs, it is essential to have skills in conducting bio bio social assessment, which to a great extent examines in the military history, exposure, substance abuse patterns, as well as current functioning. Furthermore, it is important to be skilled in the use of various screening looks tools for substance and mental health problems, such as drug abuse screens, tests, and PCL5, which should be alongside clinical interviews. Informed engagement skills. Other skills includes the ability to create a safe, supportive environment, as well as the recognized trauma responses during treatment. This, to a great extent, includes using grounding techniques and being mindful of triggers. Collaboration and coordination skills. Working with veterans with SUDS requires coordination as well as collaboration with community resources, family members, and other health professionals in order to ensure comprehensive and also continuous care is provided. Elective communication and engagement skills. Effective engagement requires strong rapport building abilities, critical thinking, adaptability, problem solving skills, communication skills, active listening, as well as the capacity to validate veterans' emotions and experiences. Now I will hand it off to Jaden.
Okay. Well, I am Jaden, and I will be sharing other issues that should be considered when attempting to engage individuals who are veterans looking to get substance abuse treatment. First, understanding military culture structure is something that veterans appreciate. Being able to provide structure while getting services is something that can make them feel more comfortable. Asking for help is difficult for a lot of people, but it is looked as a weakness in the military community. This can hinder them from speaking up and asking for help, so being aware of this can allow us to think out of the box while making them feel heard and important. Co-occurring disorders are very common within the veteran community. Many suffer from PTSD, depression, anxiety, TBI, guilt, shame. Many might also experience combat triggers like noises, crowds, and certain dates. These are all very important to remember while providing services to the veteran clients. Using trauma-informed care, providing a safe and trusting environment for all clients is important. A lot of individuals give up power by admitting they have a substance abuse problem. Creating an environment where they feel welcome, valued, and supported is crucial for their recovery. It is important to educate clients about substances and how they can affect one's life, but it's more important to point out their strengths and empower them as well. Most veterans have sadly seen a lot of the world not a lot of people see. Allowing them to feel safe and in a non-judgmental support will create a space for them to be able to express themselves more. Many veterans enter the military at young ages. For most of them, they miss their identity stage of life. This creates a developmental and identity stage in the military. They find structure, discipline, and purpose. While this is not necessarily a bad thing, they miss out on the traditional early adult milestones like going to college or family life. Veterans returning back to the civilization can be confusing and difficult for them. There are many services available to veterans when they return home that would benefit a lot of individuals. Like the VA provides mental health services, inpatient treatment services, and vet centers. There can be many benefits from treatment centers, but there are also challenges. Like I said earlier, triggers can be very powerful in treatment facilities. Loud noises, a lot of crowds, and talking about substances. It is good to be aware of individuals' triggers and to understand what could help them in that moment. Insurance has been an issue. I'm sorry, I think I skipped. I might be on the next slide. Yeah, okay. Insurance has been an issue for a lot of individuals, cutting days in treatment short, not allowing individuals into treatment facilities, and not paying all the costs in treatment. This hinders a lot of individuals to get the help that they need or want. Treatment centers have fortunately been very crowded and remain full, but unfortunately, this creates long waiting times and individuals don't have that long to wait. The last challenge treatment centers face is burnout within staff and specialist shortages. It definitely takes special individuals to come into the field, and unfortunately, there's a lack of staff. This not only hurts the facility, but the clients in the facility as well. And lastly, in family involvement and community, peer support is crucial for individuals facing addiction. Sometimes veterans are not aware of all the benefits and resources that they get through the VA. Being able to provide them the information about it can be very helpful to them. Directing them to different veterans within the facility can allow them to open up and feel more comfortable to share to someone that went through the similar things. Support systems are huge, so always being willing to direct individuals to the right place or encouraging them to talk with their family or getting their family involved in Al-Anon, Nar-Anon, etc. can be a great first step for them. Now I will be passing it to Jeremy.
Well, hello everybody, I'm Jeremy. I'm going to be talking about the 2 evidence-informed prevention treatments that we chose for our population, which is veterans. Those 2 are ACT, which is acceptance and commitment therapy, and SPURT, which is screening, brief intervention, and referral to treatment. Both have shown great results throughout multiple populations and age ranges, and both are used to help motivate the client for change. So what are these treatments?
We're getting there.
Next slide, please. Okay, acceptance and commitment therapy is a behavioral therapy that is about action, making its name ACT not only about its initials, but about the core to its therapy. However, it isn't about just any action. It's about values-guided action. Values-guided action stands for what you really want in life, what matters deep in your heart, and what you want to be remembered for. Once you have the value-guided action telling you what is truly meaningful to you, you use those to guide, motivate, and inspire behavioral changes which lead to mindful action. This is action that is made consciously with full awareness and is open to your experience and is fully engaged in what you're doing. When you put these together, it leads to the core messages in ACT. Accept what is out of your personal control and commit to taking action that enriches your life. ACT is used to teach psychological skills that help us deal with the painful parts of life, whether it be thoughts or feelings, in ways that have less impact or influence, which is also known as mindfulness skills. This ends up helping us to see more clearly what is truly important to us and to clarify our values using knowledge to guide and motivate us in setting goals and taking life enriching actions. In a nutshell, ACT is aimed at mindful, value congruent living and not symptom reduction, if I could say that. ACT has 6 core therapeutic processes to help reach the desired outcome. It starts with being present or being in the here and now. This means connecting to the moment that we're in, physically or psychologically, and turning off the autopilot in our mind. Watch your thinking. Step back and watch your thinking as if it's a car going by. Instead of getting tangled up in your thoughts, we hold those thoughts lightly instead of clinging to them tightly. Open up. Make room for feelings, urges, sensations, and emotions. Don't fight or resist them, and don't get overwhelmed, and just let them be. Pure awareness. In the mind, we have the thinking self and the self as context sides. The thinking self is always thinking. It's generating thoughts, beliefs, memories, judgments, and so on. The other side, the one that most aren't familiar with, is the self as context, or the observing self. This is the part that is actually aware of what we are thinking and feeling or doing at any moment. This observing self never changes throughout our life. Know what matters. Deep in your heart, know what you want to do while you have time on this earth. Choose your life direction, the way you really want, the way that really matters to you. This is the big picture of things. And do what it takes. This is the committed action that is guided by our values, knowing our values are good, but value congruent action is how we make our life rich and full of meaning. Value congruent action are the actions that move us toward our values. It is the doing what it takes to get to our destination. When you put all these together, when you work the plan, when you accept your thoughts and feelings and are present, when you choose a value direction and you take action, you can maneuver through the core concepts and components of ACT and come out on the other side with many beneficial changes. Granted, this is just a rough scratch the top overview of ACT right now. It is a very useful and very inspiring therapy when completed and worked correctly. Next slide, please. Oh, I guess I talked right through that, but yeah, that is kind of
bad.
Yeah. Now, SPURT. SPURT stands for Screening, Brief Intervention, and Referral to Treatment. SPURT is a comprehensive, integrated public health approach to early intervention and treatment services for substance use disorders and those at risk of developing substance use disorders. This is used at many care centers, hospital emergency rooms, trauma centers, and just about anywhere that provides opportunities for early intervention. This method is widely used because it can be initiated quickly with pre-screening forms administered to all adults. The screening process frequently uses the audit, or alcohol use disorders identification test, which is administered to adult patients who screen positive on pre-screening forms. They also use the DAST-10, or the Drug Abuse Screen Tool, which is a brief self-report instrument for population screening, clinical care finding, and treatment evaluation research. The screening process can quickly assess the severity of substance abuse and the appropriate levels of treatment. This leads into the brief intervention portion. This portion focuses on increasing the insight and awareness of the client in regard to substance use and motivation toward behavioral change. During brief intervention, clinicians will use motivational interviewing to obtain information and to seek out motivations to change, how likely the client is to make that change, and it is always client-led ways to make the change, not changes that the clinician or the therapist or the doctor think the person needs to make. Referral to treatment is provided to those identified as needing more extensive treatment with access to specialty care. These may be referrals to treatment programs or just a variable number of treatments with your therapist that is going over the results of your screening test with you. During treatment, go ahead and go to the next slide. I think I want another one. During treatment, SPURT has served more than 450,000 individuals, and the percentage of clients who stated they did not use alcohol or illegal drugs increased by 128% between the initial screening process and the 6-month follow-up. Both acceptance and commitment therapy and screening, brief intervention, and referral to treatment require training, but they no longer have a certification process. ACT requires peer counseling, workshops, and training programs, but as I said, they no longer do a actual certification process for clinicians to utilize this treatment. SPURT requires 2-hour training and a supervised test case, but no certification process is used. This increases the ability of these treatments to be utilized by more clinicians and clients, and to provide more resources to those with substance abuse needs. Both treatments are widely used and have shown great progress and great outcomes. This is why we have chosen them for the veterans population. With the reluctance of veterans to ask for assistance, as expressed earlier, these programs being client-centered, where the client makes the goals and sets the values instead of the person trying to help them, we feel they will be the best fit for our veterans and will allow for the most beneficial outcomes. That is all of our slides, and we would like to thank you for watching our presentation, and we hope you found it very informative.